respectful of everybody's time, and we have a lot to cover. I know people may be joining in, and that's certainly okay. We'll just keep on rolling. So I want to thank you for being here today. I'm Dr. Ruth Oots-Moore and have the privilege to present with she's not my student this term, but she has been my student in several classes, Cheyenne Gonzalez. And so we're happy that you're joining us today. So today we're going to talk about ending the vicious cycle, play therapy with families in chaos, conflict, and crisis. And I wanted to just start off with a little introduction about myself, and then I'll let Cheyenne introduce herself. So I have been a clinical mental health counselor for, I think I'm at the 25, 26 year mark, somewhere in there. And I've been a counselor educator for 21, 22 years, somewhere in there. And my area of specialty is counseling children and adolescents, particularly those who've experienced abuse and trauma. So one of the things that when I got out of my master's program that I found was that I had lots of skills in working with adults, but not a lot of skills to work with children because they're not miniature adults, which prompted me to get training in play therapy. And then I realized that the more I worked with abuse and trauma, and I do a lot of work with high conflict divorce and all that, then you end up in court. So I started doing a lot of work with court-ordered families and things like that. So certainly the title of this workshop, Families in Chaos, Conflict, and Crisis, that's where my area of expertise is. And so hopefully today I'll share some things that might be helpful to you in your work with families.
And hi, I'm Cheyenne Gonzalez. As Dr. Moore had mentioned, I was one of her students in past terms. So I do attend the Chicago School in the clinical mental health counseling program. I am nearing the end of my second year and I'm hoping to begin my practicum and my internship later on this fall. I have known that I've wanted to be in this field since I was about 13 years old. So this is going on 10 years in the making. I have a desire to work with children and adolescents in my own field, specifically probably focusing more on like the queer community, doing some gender affirming care, but working with Dr. Moore, just kind of learning a little bit more about play therapy. And it's kind of really opened my eyes to the different modalities of intervention that we're able to offer. So I'm really privileged to have this opportunity to learn a little bit more and get to work with Dr. Moore.
And I should have said, I am full-time faculty in the clinical mental health counseling department at the Chicago School of Professional Psychology online. So I forgot to say that. Okay, so we're going to start off with just some of the challenging behaviors that are seen in play therapy. And so a lot of times, if you know, when you're working with, you may be working with families, but you're really working with a child who is the identified client. And we'll talk a little bit more about that. But we're going to take this from the perspective of that you're the counselor working, let's say, with the client, with the child in therapy. So there may be different presenting issues. So suicidal ideation, there may be non-suicidal self-injury, they may be cutting, burning, erasing their skin. There may be depression. These kids may present with anxiety, could be generalized anxiety or social anxiety. There may be abuse and trauma, and we're going to talk about that more. Sometimes you may know going in to this work with a child that there have been allegations of abuse, but sometimes that may not come up until later on in your sessions. Attention deficit disorder, a lot of times you might get a referral for a child where they say, oh, we think he has attention deficit disorder, but there may be other things going on besides that, and certainly disruptive behavior. So the other thing to note is that when kids come to counseling, they can be very resistant. It might be that they're angry that they have to be there, and they may also be afraid to make disclosures due to fear of retaliation at home. It's like, how can I trust that what I say to you isn't going to backfire on me when I get home? So that's a challenge that you have in that setting for sure. And then aggression, that some kids that might be verbally aggressive. I've certainly had kids in the playroom who have been physically aggressive, and but being prepared for that and knowing how to handle that. And then just general mistrust, that confidentiality for minors varies from state to state, but it's important to recognize especially when children are coming from chaotic families, that there can be just an underlying thread of mistrust. And in your work with families, these same things may apply, that if you're working with a child, that the child may experience all of these behaviors in the session, but families can also demonstrate these same types of issues in sessions. So let's talk about challenging family dynamics. First of all, I want you to just take a look at this picture and tell me, you can use the chat or you can speak out if you want to. What do you see?
Like children are just messing around and the mother is not like worried about what they are doing and it's whole mess.
Yes, exactly. So mother seems kind of checked out. Somebody said a tired, burned out mom. Thank you, Catherine. Anything else stands out to you?
I see a mother that needs help.
Okay.
She has a lot going on. She's just trying to get her coffee. While the children just seem to be all over the place.
Exactly.
So help.
Something big that I noticed about this picture when I first saw it was that the kitchen itself does look like something out of almost like a designer magazine. And it really could be like a beautiful space. But, you know, when there's a tired, burnt out mom and the children are wreaking havoc everywhere, it can kind of turn this beautiful space into a bit of a disaster zone. And so it kind of spoke to me about how appearances are not everything they seem to be.
Exactly. Thank you, Cheyenne. And I'm going to just give some of the things from the chat. Somebody, Richard said, children are able to do anything without having parental authority. Certainly. Children taking over the space. Thank you, Jamie. And then Melissa said, I also see a mom by herself without a partner assisting. Yes, all of those are great points. And, you know, it's interesting because I show this photo a lot in presentations and things. And I've even had people say they would have thought that there was alcohol in her cup based on the chaos in there. They're like, I really want to know what's in her cup. Also then noting that she appears to be pregnant. So there's yet another kid on the way. And every time I look at this photo, I would see something different that I haven't seen before, like the little kid who's got his head in the microwave. So what are your, so we've had a lot of thoughts about mom seeming like not having support, mom seeming overwhelmed, not, you know, giving, you know, helping or assisting the children, the little girl standing on the countertop. What if I told you that she was the CEO of the second largest bank in the country? Would any of you be surprised? I don't know who she is. I found this picture on the internet, so.
Yeah, as you said, as what if she's the CEO of the second largest company? So yes, as like one of our like person has highlighted that looking at the interior of the kitchen, it looks like something it's really designed properly with the like whole glass and all the like maple floor wood and everything. So the way I assume is that I don't think there would be any financial condition. It's like all of a sudden she like gone through some situation in her life which she's not able to cope up mentally, and she's like really disturbed and trying to figure out that what to do next and how. So I think she's in her like restarting phase. That's why she's not
Okay.
able to focus on anything right now.
Mm-hmm. So it wouldn't surprise you financially that she could live in this space, but that she's definitely overwhelmed and struggling to figure things out. Nicolette said, child taking care of their own needs, fridge. two children taking care of each other's social needs on the floor. And then Nicolette's next comment was, not surprised, something's got to give. And I think that's a great point, Nicolette, because while one could say this is problematic, we also can see some resilience in some of these kids saying, well, okay, if mom's checked out, we're going to figure out what we're going to do. Dr. Harris said, I can see some resiliency, particularly for the kids that are meeting their needs. Absolutely. And so for me, so imagine, let's take the kid with his head in the microwave, and I'm going to call him little Johnny. So little Johnny might be the kid that gets referred to play therapy for, quote, ADHD. He's not sitting still in class. He's distracted. He's hyper, he's all over the place and all of that. And so mom may come in her stiletto heels and she's fixed up and her hair is fixed and she looks all together. So we may not know that this is what home looks like. And that's why it's important for us to really understand family dynamics when we're working with children in play therapy. So in knowing that, you know, any of those children that were in the household in that picture could be someone that is referred to play therapy. But there may be underlying family issues, and maybe those issues are reported to you when the parent comes in for the intake, maybe they aren't. So there could be abuse and violence in that situation. In the photo that I just showed you, maybe there's domestic violence. We don't know, but based on the photo, but there could be underlying things going on. Could be substance use. There could be, maybe there's a high conflict divorce and mom's trying to figure out how to rebuild in co-parenting in two separate homes and all of those adjustments. There could be an absent parent. Someone mentioned that there is, you know, she doesn't appear to have support, at least in that moment. So there could be an absent parent or even abandonment. There could be mental health issues with parents, or there could be issues with siblings. I've seen a lot of kids who are referred to play therapy for depression, anxiety, but then when you start to figure out what's going on, it's like, well, there's also maybe there's a sibling with autism that parents give all their time there, or maybe there's a kid, you know, with this having trouble in school and all the focus is going there. It reminds me of a teenage girl that was referred to me for depression and binge eating, and she had a brother who had chronic anxiety and was refusing to go to school, and that was causing parental stress and conflict with him, and they were fighting over, you've got to go to school. And meanwhile, she was just kind of this wallflower that was just sitting there in binge eating and then later engaging in self-injurious behavior. So there could be other factors going on that are taking away from that particular child. Cultural considerations, and Cheyenne will talk about that in a moment, but it is important that we keep that in mind when we're looking at families and how they present in counseling. So understanding this vicious cycle, and I'm sure you all have seen this in your work with children and families, is that there's there's a family dynamic and a reaction, and then there's the child's perspective of that. You know, mom doesn't love me because she doesn't pay attention to me, and so then they have a reaction, and then maybe their reaction is that they don't listen or they engage in power struggles, and then the parent has a perspective. You know, this child doesn't respect me, and then they get in power struggles, and it leads to a family dynamic. So it's this vicious cycle, and it really is figuring out, how do we break this cycle as counselors and play therapists? How do we do this? So I operate a lot, especially in my work with parents and families, on using Adlerian theory and understanding the purpose of the behavior. So with Adlerian theory, behavior is purposeful, behavior is goal-directed. So imagine, going back to the photo, that this mother comes in and she says, you know, I'm just really overwhelmed because, you know, I can't get a moment of peace. I'm pregnant, you know, I'm tired, I don't feel well. These kids won't listen. They're climbing on the walls and the cabinets and all of that. These kids are bad. And it's like, well, they're not bad. You know, there's a purpose of that. There's a purpose for that behavior, whether it's to try to get your attention, and I'll talk about that in just a moment, but it is goal directed. And I think sometimes if we can help parents understand that whatever this kid is doing, you know, they're smearing feces on the wall, that there's a purpose behind it. And if we can better figure out that purpose, then we can know how to respond to the child's underlying emotional needs. So Dreikers is an Adlerian theorist, and he had 4 goals of children's misbehavior. And he talked about that children typically, quote unquote, misbehave to get attention, gain power, get revenge, or to display feelings of inadequacy. So when you think about that, think about like to get attention. Think about back when you were in school, when you had that kid in the class that was the class clown. And it's like, why was that kid the class clown? They're getting in trouble all the time, but really all they were doing was attention seeking, right? Or maybe you were the class clown and were attention seeking. And that it really is sometimes better to get negative attention than no attention at all. Sometimes it's to gain power. So this is kind of like, dad tells you to do something and you say, the kid says, make me. Or one of my favorite examples was I was working with these 2 children and the mother in a family session, and she told the little boy was all over the place, and this was the same girl that I told you had been oh no, this is a different one. Sorry. This little girl, though, had also been binge eating and had put on like 20 pounds. She was like 10 years old and put on like 20 pounds in just 20 pounds in a couple months. But the little boy had a diagnosis of attention deficit disorder. So they came in and we did a family activity. They could choose whether we were going to do art. They had to do an art activity together or a puppet show. And they all chose the puppet show. And so then the task was to select a puppet. And first of all, the mother kept saying, you've got to sit in a chair. The little boy was all over the floor. You've got to sit down. You've got to sit down. You need to sit down. And first they got in a fight over who was going to be the snake. The little boy wanted to be the snake and mom wanted to be the snake. And he's like, I want to be the snake. I want to be the snake. I'm going to be the snake. And I was like, yes, you are. But they got into that power struggle over that. And then he kept getting on the floor and she finally said, you've got to sit down. You've got to sit down. And so he did, but he sat in the trash can. So he put himself on the edge of the trash can. And then he fell into the trash can and got stuck. And I was a doc student at the time. And I thought, how long do I let this go before I intervene? And finally I had to, but the mom was so frustrated. And she's like, do you see this? Everything is a power struggle. And the little boy's going, what's a power struggle? What's a power struggle? What's a power struggle? And it was total chaos. But this was what was occurring at home, no matter what she said. And she was like, remember that movie Married to the Mob she was a really big, strong woman. But no matter what she did and what she said, he was going to test the limits there. So certainly how we teach this mother to respond is going to be different than just attention seeking. So getting revenge, this is where they do things intentionally. It's beyond power struggle. It's about, no, I don't like you because of this, or I want revenge because you did this. And I see that with kids who've been abused a lot, is that whether it's they're wanting revenge over the abusive person or they want revenge and they take it out somewhere else. So think about kids who bully, that maybe they're being abused at home and they just want revenge. So they're going to take it out on someone else at school. And then displaying feelings of inadequacy. So this is where kind of like playing the martyr, like, woe is me, poor me, I can't do it, kind of that learned helplessness type of thing. But again, how we help parents respond, we can better help parents respond to their underlying emotional needs if they understand the purpose of the behavior. Little Johnny wants attention. Let's find some ways to give him attention in a positive way so that he's not trying to engage in negative attention. If it's to gain power, let's find some ways to empower this child so that he doesn't feel like he has to engage in a power struggle to level the playing field. So incorporating family therapy into play, I like this quote, family means no one gets left behind or forgotten. And certainly it's important to remember when we work with families that there are sometimes family members that feel forgotten. So I'm going to turn it over to Cheyenne and let her talk about some of the benefits of structured play with families.
Thank you, Dr. Moore. So some of the benefits that we have listed, and this is not an exhaustive list, but it is to establish rapport with the family members, to empower different members of the family, facilitating disclosure, encouraging self-expression, decreasing feelings of anger, hostility, and shame, and then also helping them gain insight. And working with families in the therapeutic setting is really important for these reasons and others. When we involve family members, we are able to help our clients' support networks, which can be a really big part of their treatment because these are the people that they are spending most of their time with. You know, when we are encouraging self-expression, not just from our client, our identified client, but then also the rest of the family as a unit, we're utilizing and potentially encouraging those communication skills that then can be used at home and hopefully improve the family dynamic as well. You know, also when we're having a session with family members, we're helping to validate their feelings, which can potentially decrease those negative reactions of anger, hostility, and shame. You know, these sessions really are for the client, but we also want to ensure that we are, you know, engaging the family members. That way, the benefits that we're seeing in session can transfer to the home dynamic as well. It's also great to gain insight because we're creating a safe, vulnerable place where the family members can freely express their thoughts and their concerns that they might be having that they might not get to express at home. You know, they might say, oh, I never knew you felt that way. And so that's why these conflicts have been ongoing and haven't been addressed because nobody felt like they could safely say anything and kind of address those issues. But when we're giving them a chance to openly confront those issues, you know, with us as a mediator, we're able to help them gain that insight of to, you know, here's the problem. I didn't realize that this was a problem. Now we can actually start working on it. If you want to go ahead and go to the next slide, Dr. Moore. So some things to be mindful of when we are involving family in session. First, you want to be careful not to assume what the child or the family's therapeutic needs are. You know, counseling and therapeutic interventions are not one size fits all. And so it's important to take each client and each family as individual units and take those into considerations as unique individuals. So second, implementing structured play only after a relationship has been developed and a thorough assessment has been conducted. This is really big because once again, intervention is not one size fits all. We need to ensure that a thorough assessment has been conducted. That way we're able to get necessary information that's going to help us inform treatment, inform those intervention techniques. And that's also going to help us determine what structured play activities are going to be helpful for this family unit. And then finally, we have to understand, like Dr. Moore was saying earlier, that there is often deeper underlying issues. You know, it's not as simple as my kids don't listen, they just don't care about this family. They could be bullied at school, they could be suffering from an undiagnosed medical or mental health condition, something that's causing them discomfort, that's causing them pain, that's causing them anxiety or depression or anything else like that. They just might be suffering. You know, their parents could also be getting divorced. And so they don't feel like they have any control over their lives. They feel like they have to do something to take back that control. And that's where some of that misbehavior kind of comes into play. You know, it also goes the other way too, where children might feel like their parents aren't giving them enough attention. They are invalidating their feelings. But you have to look at it too. The parents, you know, especially if we're working with older children or teenagers, those parents might be of an older age. They might have suffered the loss of their own parent, and that can be detrimental to their own mental health as well. They could have stress from their jobs. They could also be dealing with trying to break some generational trauma, and they are just not sure how to do it. They think, oh, well, this is how my parents raised me. I know I don't want to raise my kids this way, but I don't know any other way to do it. And they're just not sure, and they kind of need that assistance from us. Go ahead to the next slide.
And I was just going to add to that. I think that was a great point, Cheyenne. And, you know, when I went over the slide with the vicious cycle earlier, you know, I gave the example that, you know, it could be a family stressor and then the child has a reaction. But I think Cheyenne made a great point about the child could be bringing something into the home environment that maybe they're being bullied. Parents don't know what's going on. All they know is they've got this kid that's having meltdowns every day, or maybe this parent is having job stress that's spilling over into the family environment. So it could go either way, that it could be family stress that plays out in the external environment outside the home, or it could be the other way around, stressors in the external environment that you bring into the home environment.
Okay. So next I want to talk about psychoeducation and just the importance of really kind of integrating that into your sessions with the family members. So some reasons that we would want to educate the family members on the mental health conditions as well as the therapeutic interventions that we're using. It helps us gain that support from family networks, especially from people who maybe have never been to counseling before, don't really believe in mental health or that there are mental health issues, or that even someone as young as their child could be suffering from those mental health issues. So really educating the family, it kind of helps get them over to our side and kind of understand things from that therapeutic lens and really get that support. Additionally, it is going to destigmatize those mental health issues, or at least hopefully it is, being able to kind of help them understand, oh, there's not something wrong with your child is not defective. These are things that real people suffer from, and it is something that we can work through and get them the help that they need. It doesn't have to be something shameful. It doesn't have to be something that, feels like, oh, it's hopeless, we might as well just not even try. We can talk about those mental health issues and we can really destigmatize what's happening with them. And then it also encourages the open discussion of those mental health needs. Not everything has to be a big, have to go to therapy or counseling problem. Sometimes it's just as simple as, mom, dad, I'm feeling really stressed out from school. I think I just need a mental health day. I just want to be able to take a moment to breathe to myself. And, the parents might not understand that before counseling, but then after counseling, they're going to be able to see, oh, my kid needs to be able to just relax every once in a while. They're stressed out. They have a lot going on. They feel comfortable talking to me about those mental health needs. And the same thing goes for the parents too. Kid wants attention and they're going, mom, 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 mom. Mom's eventually going to get stressed out, and she can hopefully communicate to her kid and be like, mommy just needs a moment of silence. Like, let's just hold on. Let's take a deep breath. Let's calm down, and then tell me calmly what you need. And it's little stuff like that that I don't think people really think of as discussing your mental health needs, but a little bit goes a long way with that kind of stuff. We'll go ahead to the next.
I was just going to add too that sometimes by providing parents and families with that psychoeducation, there's a sense of relief around it. And I mentioned that my area of specialty is working with abuse and trauma. I've got a subspecialty in working with preschool age children who've been sexually abused. And so a lot of those children that I see have well, of all ages, but have been engaging in inappropriate sexual behavior. So let's say you have a parent that doesn't understand why their 5-year-old is engaging in sexual acts with a 3-year-old. I mean, that's overwhelming. And tantrums are overwhelming all of the behavioral issues, but then to see this and really the shame around that. But when you educate them on, well, when there's been abuse and that this isn't, that this is what they're trying to do is to make sense of this, but giving that educational piece, it's like, okay, you mean I'm not the only one that's ever experienced this, so there is that piece of just helping them understand that this isn't that, as you're not crazy. This isn't, this isn't unheard of, that, and help them just know how to work through it.
Definitely. So we're going to move on to some cultural considerations, but first I want you to think about your favorite pair of sunglasses or prescription glasses if you wear them. If you want, you can put them in the chat, the things that you like most about them. Maybe the frames are a really, really cool color or pattern. They fit your head really well. They don't pinch your nose, which I've been wearing glasses since I was 6. I know that is something that can really irritate you. It just kind of feels like they were made for you. I want you to also imagine that one day you bump into a stranger and you accidentally grab their glasses, or maybe you swap with your mom or your sibling or your partner. Those glasses are not going to fit you as well just because they're not yours. Maybe they're red and you like blue better. You don't like the tint of the lenses, or, they just don't fit your head correctly. It's going to feel a little bit odd or a little bit weird, and it could also feel different in a good way. You might not have noticed that you like the tinted lenses a little bit more. That color really suits your face, or those frames look really good on you. This is kind of like understanding someone from a different culture from yours for the first time. Things look a little bit different, they feel a little bit different, and sometimes people might even treat you a little bit differently because of that culture or because of the glasses that you're wearing. You have those new glasses on, you might get compliments, but some people might also be a little bit rude to you. Regardless, it is important that you try to see things from those new lenses and really kind of understand and appreciate those different cultures. Even if the glasses don't feel right to you, that doesn't make them wrong. That just means that they are not yours. And so it's important to consider that with other cultures as well. Just because someone has a different culture than mine, that doesn't make it wrong. That doesn't make it not right. It just means that's their culture. It's not mine. I'm happy to learn about and appreciate and respect it though.
And I think also when you talk about your cultural lens, it's recognizing that I can get very comfortable in my same pair of sunglasses that I've been wearing for the last 10 years. I, keep them in my perfect little case and I wear them and I look through my own pair of sunglasses. And that when you're working with, especially culturally diverse families, we talked about just a moment ago, psychoeducation. If you're giving psychoeducation to a family based on your own cultural lens, your own, white female lens, when you're working with a family from Pakistan that's Muslim, I can't do that from my own cultural lens. And so really being mindful of that.
So some different cultural considerations that I just want you to keep in mind. This is not an exhaustive list either. It could be a variety of races, ethnicities, sexual or affectional orientations, religions, socioeconomic statuses, ages, geographic locations, and occupations. And so we're also going to talk about cultural humility. So play therapists should have an understanding of their clients' cultural beliefs and values, and they should also self-evaluate and examine their own cultural beliefs. So basically, cultural humility, it's basically a lot of self-reflection that allows an individual to willingly learn and honor various cultures and the beliefs, values, and customs that go along with it. It's a willingness to learn what your culture means to you and why those identities are important, and then doing the same for others. It's recognizing the privileges that you have due to your cultures and the lack of privileges that other people don't have because of their own cultures. And it's also trying to rectify those power imbalances as well. I believe that acknowledging and respecting our clients' cultures can do a lot for the Therapeutic Alliance. And it's cultural humility is a tool that I think that everyone should learn, just because it really can go a long way to saying, I respect you, even though you and I are different from each other. And I'm not going to judge or berate you or shame you because your culture looks different than mine. So cultural sensitivity when working with families. With families, it is really important to be mindful that some parents may have more traditional to their culture values and beliefs. We do need to respect these, but we should also use psychoeducation tactics to encourage new perspectives, especially when it's what is best for our clients' well-being. So respecting those cultural values and beliefs, but just kind of helping them open up a door through that psychoeducation that we talked about earlier. Introducing those new perspectives and beliefs can be a little bit difficult for people. Even coming to counseling can be difficult for some families. It can be a really huge, daunting step that they have taken. And so it's important that with these caregivers, we are validating their feelings and we are asking them for their thoughts on the process. It can also be really good for us to kind of understand where they're coming from with their own choices and beliefs as well. It's also important to be mindful of who the client is, especially if it is a child that we are working with and we are still, validating the caregiver's thoughts and feelings, but working with the whole family as a unit, when you're validating their thoughts and feelings too, it's going to go a long way to help getting them onto our side. And it's going to also help continue to endorse the necessary positive changes for the sake of the client. Finally, we should make every possible effort to accommodate the families that have those different cultural considerations to take into account when we are counseling them. We want to effectively involve them in the treatment. So if a translator is needed, we should not put that pressure on the client whatsoever, because they are there to get help as well. We should, reach out to be able to get an additional resource. That way we can get someone who can effectively translate, be impartial, and not have to put that pressure on the client at all. Respecting their wishes for gender of the provider is also necessary, but it should not be confused with discrimination of the provider. Other examples could include maintaining eye contact, seating arrangements. If I remember I had a professor in undergrad who worked for the VA, and she had several clients who were military veterans, and they requested that they be seated with their back to the wall, eyes on the door, She would keep her hands on the top of her desk at all times because these were people who had PTSD, and it kind of concerned them if they weren't able to see the door, if they didn't have their back to the wall, if they weren't able to see their hands, because anything could happen. And so that is just another example of another culture to consider and another accommodation to make. And obviously this would be something to talk through with your clients as well, talk through with clients' families, and just kind of see what can I do to make you most comfortable in our sessions. That way we can really facilitate an active, healthy learning environment. And I'm going to turn it back over to Dr. Moore now.
So I'm going to talk about some structured play activities, and I should have said this at the beginning of the presentation because a lot of the slides will say play therapist, and obviously we're counselors. And so for this presentation, for those of you who are getting continuing education units, obviously this does go towards NBCC, but if you want play therapy credit, play therapy CEUs, then the presentation has to use play therapy and play therapist to have that. So, but we use that interchangeably, and we talk, Dr. Clark and Dr. Erickson and I talked about this in our workshop yesterday about working with children, that you don't have to be a play therapist to implement play and counseling, but you do want to have training, and you can use creative counseling techniques, but just making sure that you have that training. So the activities that I'm about to talk about, you can use as a counselor. And if you're not familiar with the Association for Creativity and Counseling, part of the reason that Dr. Thelma Duffy founded that organization was to give counselors a space where they could implement creative interventions across the board. So you didn't have to be a play therapist to implement play and counseling. You didn't have to be an art therapist to implement art and counseling, but making sure that you're trained and but can still implement those approaches competently. So I just wanted to add that piece. Family means no one gets left behind or forgotten. I think I said that already, so I must really like that. I meant to put that at the end. We'll talk about that in just a moment. Okay, so I want to talk about, sorry, my slides are a little bit out of order. For the sake of time, if we had more time, I was going to do a role play demonstration, but I know that I mentioned this in the learning objectives and wanted to make sure that we covered it. But we want to look at so a lot of times what I'll do when I have a family together, and I should first say when in looking at the roles of family, that if you're working with a child, the child is the identified client, but it doesn't mean that you can't involve the family in that child's therapy. You've got to be cautious. If the child is your client, your allegiance is to the child, but you can implement the family. There are also other times where maybe you are just doing family therapy with the family, and that none of the kids or family members are your identified client. The family is the client. But you do want to make sure that understand the role. But what I'll do a lot of times is have the family role play how their current family is. So I might say, y'all mentioned that usually at the dinner table, that's where arguments break out. So, okay, Mom, Susie, I want you to play kid Jane, I want you to play dad. Have them assign a different family member role. And so they can talk about, play the role of what dinner table looks like. And so let's say that the teenage daughter says, well, I'm going to be mom. And mom is, you can't do anything right. Every time I tell you to do something, you screw it up. And so it's a good way to hear everybody's perceptions of the other people. But then I'll say, okay, now I want you to take that same role, but to word it how you'd like to be talked to. So then maybe teenager says, as mom, wow, sweetie, you've worked really hard studying all week, and thank you so much for all you do in the family. And then you can help them process, like, okay, there's a lot of anger that I see here. There's a lot of yelling that I see. There's a lot of nagging or perceived nagging on this one's part. But there also seems to be maybe a desire to have more praise or affirmation. So it's really helping them kind of break down those dynamics and look at, what, instead of getting so lost in the conflict and the chaos and the screaming and the yelling and this and that maybe looking at how can I look at what I really need from you and express it in a different manner. So I use a lot of music in therapy, whether that's children, adolescents, adults, families, all of that. Sometimes I'll ask them to bring in a theme song, a song that speaks to them, or a client that is a song that's meaningful to them, to bring in something that speaks to them. I once had an adolescent client whose father was physically abusive to the mother. And he felt very powerless because he was 15, he wanted to be able to protect his mother, but felt that he couldn't. And I asked him to bring in a song that spoke to him. Well, he actually burned me a whole CD, and it said "To the Greatest Counselor, Dr. Ruth" on it. But we broke it down because it's a whole CD. But it was interesting that one of the songs, and I usually play it when we have more time, but it was a song called "Oxycontin" by Little White or Lil White. But the whole song is about taking Percocet, take some Crown and wash it down. Now I need a Seroquel. And I had no idea that this kid was, he wasn't using drugs, but he had been approached and was considering using drugs. And eventually he did on a dare, he would take a pill here or there. But if it was concerning, because if anyone had done what the song said, they would have been dead. But that was one of the songs that he brought in. Another song was on the CD was "I Love This Bar," and it was talking about use of alcohol. So I learned a lot that I wouldn't have known. I had the family bring in a theme song, and you can do that at different times. Maybe when they come in, have the family each bring in a song that they think represents the family. But then as they move through therapy, I've had some cool things like, okay, what's your theme song now as a family? I never will forget the family that came in, and it was that "We Are Family." And it was really cool to see, because when they came in, they all had very negative songs about the family, very dark, those types of things. And then get moving. A lot of times I'll just have, when I'm working with families, we'll get moving, whether we turn on music, I've got some little feeling balls and things that we toss, where they have to answer a feeling, but we play music, we move around just to get that energy going, because a lot of times those families that come in are so angry and resistant, mistrustful, all of those things, that they can't get past that shell. And it kind of helps them loosen up a little bit. So if you cannot get rid of the family skeleton, you may as well make it dance. So I used Laffy Taffy a lot with my families, and I like them. They even come in the cool stick, and you can make little symbols out of them and things like that. You're not going to use candy with, know your client, know your family. If they've got diabetes, we're not going to do that. If they're, but you can still use the Laffy Taffy, because what I like about Laffy Taffy, y'all know that they have the corniest jokes, right? The corniest jokes on Laffy Taffy, but that's one of the things that I want to do, is help families tap into humor. So I pulled a couple of Laffy Taffy jokes for you, and feel free to shout out or put in the chat. What did the house wear to the party? Any ideas? A dress. So corny. And what did the girl say when the boy asked her for a date? That should have said "boy C." Sure. That's so corny. But what's funny is when you use this with families, it's funny to see their reactions, because, sometimes you get the eye roll and so corny, and it is. But then I can say to them, when was the last time you laughed together? Or tell me about a time, that you've laughed over the years as a family. Now, maybe they say we've never laughed. And okay, well, that is certainly good to know, that if they've never had a moment where they could be frivolous and carefree and laugh together, that's certainly, much more work that needs to be done with that family unit. But if they can tell you, well, we used to take a vacation every year until Dad had to take on the second job, and now he's stressed out all the time, and we don't get to do that anymore. So it's just going to give you some insight. Tools in your toolbox. This is one that I use a lot. You can get these from Oriental Trading, these little foam packets that have the little different tools that come with them. You can get them in different sizes. This was like a little kit, I think, came like a Father's Day something, and you could make a frame. But so I'll often ask families to think about the tools that they have in their toolbox, their existing toolbox, and where they might be in the beginning versus where they are in the middle or where they are at the end. You can decide where you want to implement that. But this was an actual, it's a remake, but it was one that was actually done by a father. I was working with the daughter, and she had an eating disorder, but she was also engaging in cutting. And the father was a CEO of a very large company and traveled a lot. And so it's the dad, mom, and 2 kids. And when dad was away, so dad, I can't diagnose because he wasn't my client, but he really, really, really had a lot of OCD, traits. To the point that if she was when he made the daughter mow the grass, he measured it with a ruler to make sure it was a certain height. And then there were 4 members of the family, and they had an 8-piece place setting in the cabinets. And so when the mother would wash the dishes and put them away, only the top 4 plates were getting used, and he wanted the plates rotated on a regular basis so that they all got used the same amount. So you can imagine when dad is away, everybody breathes. It's not as stressful. He comes home, it's very stressful. But he travels for a week or 2 at a time, comes home, he just wants to decompress. Here's mom saying, "You've been gone. I need your help." So she's on him. He starts yelling. So this was kind of midway as we've been working together. And at one point he said that, so when we did what are the tools in your toolbox, he said yelling is still his tool, a tool that he uses, but he had the hammer of express because he was trying to work on expressing himself and not yell, but he recognized that he still had those tools in his toolbox. One of the tools was alone, and alone meant alone time for him. And that was a tool that he really wanted and needed to use, but he wasn't necessarily getting. Same with jogging. And so if he said, "I want to go for a jog," everybody, mom's getting mad, need you to help with homework, I need this, I need that. And so, but it was very insightful for him to be able to recognize that while yelling was still his probably dominant tool in his toolbox, the one he used the most, that he still recognized that he wanted to include some other tools, or had some tools in his toolbox that he knew worked for him. He just needed to be able to use them more. So I know we're getting close to time, and so we probably don't have time to do the activity. I was going to show you a virtual sand tray activity that you could do. But sand tray is something that I use also with families, with children and families, but it allows them to express their emotions in a safe environment and connect to those emotions without necessarily having to own them. And it can improve family communication and connection. So if you copy this link, I could put it in the chat, I think, maybe. Oh, sorry, maybe not. Let me put
I
it
can
on
go
there.
ahead and put it in the chat, Dr. Moore.
Okay, thank you. So this is the sand tray. It's a virtual sand tray. It's free. But when you go there, you can select different figures, or what, so to speak. So in person, I actually have sand trays in my rooms where you have different figures that they can use, whether it's animals or superheroes or all of the above, that you can have in there that they can kind of display their environment. But I'll ask them to do a representation in the sand of what you think your family is like. So I just did this one today of my own family, and I did the crab because I'm a Cancer, and I did the stethoscope because my husband is a physician, and I used the butterfly to represent my parents because when my dad was ill with cancer, my mom and he really had this bond. They had a cocoon, and they watched or a caterpillar, and then the cocoon, and they actually watched it in a jar, develop into a butterfly and then released it. And so it was a really just a very special moment with them during that time of his illness. In the center, it was supposed to be more in the center, but in the center of my sand tray is the sun and the pool, which represents my son and the travel that we do together and how much he loves that in the water. And many of you know my son has autism, so I put some cloudy skies with some raindrops, and I put a storm, but I also put a rainbow because with autism there are challenges certainly that he experiences and that we experience as parents. but that there's always a rainbow, and that it at the end of the day, it always works out, and there's always can be a silver lining or a rainbow at the end of that. So if you think about it, some of the worst storms that you ever encounter, at the end, you see a beautiful rainbow. And that was what was really meaningful to me with that. So I had hoped that we would have more time to be able to do this as a group, but for the sake of time, and I do want to have a few minutes for some questions before we go. Let's see if we got in the chat. So Cheyenne put that in the chat. There's a message from Holly about just about attendance. Does anyone have any questions that you'd like to ask or would like to put in the chat?
Feel free to also come off mute and ask them as well.
Absolutely. Is it too late, or it's closely after lunch, right? Everyone's tired. Okay. Any thoughts about how you might use some of the things we talked about today in the work that you're currently doing with your clients?
I know for me, in thinking about how I might incorporate creativity and counseling in my future use, I think especially with the work that I want to do, like Dr. Moore, with children and adolescents, but then also with the queer community, it can be really useful to use those forms of expression, especially since those marginalized communities may not be used to someone asking, hey, how do you feel? How are you feeling about this? Especially if they are potentially facing some resistance from their family or neglect or even abuse from their family after they have come out or are transitioning or attempting to transition. Having family therapy and family counseling sessions and really being able to say, let's use these different modalities to be able to communicate and express ourselves. That's really going to help open up and, make them understand that this is a safe, comfortable place, and we are going to put in the work and we are going to help you through this one way or another.
Thank you. A couple questions, or Jamie said, I appreciate the use of a family song and would be using that in the future. Thank you, Jamie. And then Nicolette said, question about placement of the figures in the sand tray. Absolutely. And we could spend maybe I'll do that next year for the virtual conference on sand tray. But yes, certainly where things are positioned. And you'll see that a lot of times that you might have a child that's really estranged from a parent, and that this one's way over here in the mud in the sand tray over here, or this one is an evil demon that's way over here and the family is over here. So certainly there are all kinds of dynamics that you can assess. And even for me, I just said Wesley's the center of the sand tray. And so yes, that's definitely the place, not just the figure selected, but the placement of the figure that's selected, and then getting that child or family to process that. So when you're using this with families, you can ask each member of the family to put their figure in, the figure that represents them, and you can have them, each of them position the figures. You can do it so many different ways. Each family, you can get a little shoebox, and everybody has their own shoebox full of sand, and they can make their own family sand tray, and then talk about how this is how I perceive the family, and gaining that insight. So I know that we are at the cutoff time, and I want to be respectful to the next presenter. I just want to thank you all so much for coming and spending your afternoon with us today. And it's been my honor to present with you, Cheyenne, and to be with you all today. So thank you so much for coming.
Yeah, it's definitely been a wonderful experience. This is my first time presenting, and so I really appreciate you all being here with us. And thank you again to Dr. Moore for the opportunity.
All right. Have a great day.